Hi, this is Christine from the Healing Accord with information on the new service red light therapy. I'm looking after my friend's dog, and every time I speak, she's up. And unfortunately, I have a wood floor, so she's tiptoeing and tap dancing on my floor, aren't you? I think she thinks I'm speaking to her because there's nobody else here. Anyway, red light therapy, the benefits, the side effects, if any, and the uses. What is red light therapy? Red light therapy uses the therapeutic application of light energy primarily to aid in the healing of skin and muscular conditions such as scarring and tendinitis. By exposing the body to a low wavelength of red light, 620 to 750 nanometers, red light therapy stimulates increased energy production in the cells, which may lead to a myriad of health benefits. It's already been used with success in many different clinical settings. Red light therapy works by activating your mitochondria, or the powerhouse of the cell. With this boost to the energy center of the cells can do their job more efficiently, such as healing and growth. Red light therapy and other low-level light modalities take advantage of a phenomenon called photobiomodulation, which is how different components of our cells are activated or respond to different wavelengths of light. Red light therapy is non-invasive and doesn't cause trauma to the skin, meaning positive effects are seen without the discomfort, healing time, and possible reactive swelling of traditional lasers. While red light therapy can penetrate the skin up to 6 millimeters beneath the surface, it doesn't have to cause damage in order to boost cell activity. The benefits of red light therapy. There are many potential uses and benefits of red light therapy. One of the most commonly cited benefits is improvement to the skin. It has been used to address signs of aging and skin damage such as fine lines, wrinkles, and age spots by stimulating collagen production. The most notable benefit of red light therapy is the improved quality and texture of the skin. Fine lines and wrinkles. A 2020 study in the Journal of Drugs in Dermatology found that light-emitting diode (LED) phototherapy may be effective when it comes to treating aging skin, with red light therapy showing promise for positive skin rejuvenation effects by boosting fibroblasts, which make collagen and in turn give skin its structure, strength, and elasticity. Acne. Light therapy has been used to treat acne for years, especially in conjunction with medications and therapies meant to enhance the light absorption. Red light therapy has been explored as an acne treatment. One recent small study showed that treating acne with red light therapy reduced mild and moderate breakouts by 36%. Scarring. Skin fibrosis, i.e. scarring, annually affects more than 100 million people worldwide. There's a growing body of evidence that red light therapy may help modulate key cell characteristics that contribute to scarring. In this case, red light therapy is used to reduce collagen production in scar tissue, improving or preventing thickening scars. Wound healing. Difficult to heal wounds like diabetic ulcers present a major skin treatment issue. However, red light therapy is showing promise when used for the acceleration of healing. Researchers say that it is once again likely to increase the cell mitochondria activity, fibroblast proliferation, and collagen production that may contribute to this potentially positive red light therapy effect. Little summary: increases collagen production and skin repair, supports detoxification and circulation, benefits for the thyroid and hormones, for hair growth, thickness, and shine, optimizes metabolism and energy levels, supports healing and recovery. Hair growth. Red light therapy has been shown to reduce the effects of androgenetic alopecia, the most common form of hair loss caused by a genetic predisposition to an excessive reaction to androgens like testosterone anytime after puberty. By decreasing inflammation and increasing blood flow and circulation to the scalp, it has the potential to bring more cell activity and nutrients to that area. Recent studies indicate that using red light therapy may promote increased hair thickness and density, but more research is needed. Relief from chronic disease symptoms and reduction of pain. One potential application of red light therapy is to treat chronic pain conditions. One study found that red and infrared light therapy cut osteoarthritis-related pain by more than 50%. Red light therapy may also reduce neuropathy pain, according to recent research, as well as other pain-related conditions. Bear with me a second. You pick your moments, matey. Promotion of brain health. Research is increasingly demonstrating the benefits of using red light therapy for dementia, stroke, depression, anxiety, and other brain conditions. Continued studies indicate that brain photobiomodulation therapy may enhance the metabolic capacity of neurons and stimulate anti-inflammatory and antioxidant responses, as well as neurogenesis, the formation of new neurons. This may be particularly helpful for individuals dealing with memory or mood conditions. Thanks to the minimal risk, many researchers believe that red light therapy for brain disorders will become one of the most important medical applications in the coming years and decades. Enhancement of fat loss. There are studies showing that the application of red light may affect adipocytes, the cells that store fat. One older study published in the journal Obesity Surgery in 2011 found that when 40 adults with excess weight were regularly exposed to red light therapy, their adipocyte cells released triglycerides, resulting in fat loss. Participants in this study lost approximately 2.1 centimeters of girth over a 4-week period. Another 2015 study of 64 women living with obesity, published in Lasers in Surgery and Medicine, found that red light therapy could increase fat loss when coupled with exercise. In the study, 2 groups worked out for 20 minutes 3 times per week and then received red light therapy or a placebo light therapy. Those who worked out and then had red light therapy exhibited a greater reduction in fat mass, indicating that red light therapy may improve metabolic inflexibility. Acceleration of sports recovery and injury prevention. Light can speed up the respirations process in cells and increase ATP and other mechanistic factors. You stimulate cellular energy and you stimulate the body's ability to repair. Because of this, red light therapy may be promising when it comes to the treatment and prevention of a range of musculoskeletal conditions, including tendinitis and carpal tunnel syndrome. I've now got a dog sitting on me. Benefits of red light therapy, again, summary: reduce acne and acne scarring, enhance health and wellness, improve muscle recovery, improve sexual performance. When we feel better, we perform better in all aspects. Relieve pain and improve joint health, increase collagen production, improve mood and energy levels, reverse skin aging, reduce inflammation, improve wound healing, improve sleep and circadian rhythm, increase melatonin levels. Side effects of red light therapy. In general, there are really no major side effects of red light therapy, and when used correctly, has many undeniable benefits. However, individuals who have a condition with photosensitivity, like lupus, or who are on medications that make them photosensitive, shouldn't use red light therapy. It's not recommended for pregnant women just for now, because red light therapy hasn't been well studied in relation to pregnancy. There have been clinical reports that show visible light can induce melanin migration from the basal layer of the skin to the surface in darker skinned individuals. This means that visible light, which includes red light, can potentially aggravate hyperpigmentation and melasma in dark-skinned people. More studies are necessary to confirm these findings. As a result of this potential side effect, it is suggested that people should remain aware of how long and how often they are using red light therapy, especially with dark skin tones. Incorrect or overuse of red light. Too much of anything good It's like too much of a good thing is a bad thing. Too much light may damage skin tissue. Too little may not work as well. So there are no major side effects. It's a non-invasive procedure, and the only issues would be incorrect use, overusing it, spending too much time on it, not going by the recommendations, and not following the correct procedures. Who provides red light therapy? Some examples of the most common providers, although not all of them will have the service or will offer the service: doctors, salons, dental surgeries, even veterinary surgeries, dermatologists. You can also buy your own red light therapy devices, face masks, red light bars. There's loads of different products out there. Although without experience, at-home treatments are more likely to cause side effects or injury. And again, it's through incorrect use. This is the lights I use. It's a forehead 360 adjustable, and it can go low, it can go high. The foreheads can stretch across parts of the body. And this is 660 nm red and 850 nm near infrared red light. About the lights I use and your session. So the lights cover a large area of the body. Forehead universal hose infrared light, which can freely adjust 360 degrees with a wider lighting area. It's equipped with lifting brackets, which means I can adjust the height to meet the needs of the different scenes, whether you're sitting in a low chair, a high chair, a bed. 5 dimmable modes. The infrared therapy lamp has 5 brightness gears. Each level has stable brightness and pulse mode to meet different body pain, infrared light treatment needs. According to your actual use, the all-in-one device can solve various needs. There is a time and function of 5 to 30 minutes, which will auto turn off when the time is up. 660 nm infrared light can get into deep layers of the skin so that it stimulates cellular repair and increases circulation. 850 nm NIR light can penetrate and generate thermal effects, promote blood circulation, enhance metabolism, and improve cell vitality. So yeah, back in the door. You may sit or lie down on the treatment bed, whichever is appropriate for your particular session, and that'll depend whether you visit me or whether I visit you, and what it is we're treating. The lights will be positioned anywhere between 6 to 10 inches from the area being treated, close to bare skin where possible. So if it's a full body treatment, minimum clothing, so I'd suggest a pair of thin cycle shorts and a thin vest top or something. The less barrier there is between skin and light, the better. So no body lotions or makeup or anything like that neither. Treatment lasts for a maximum of 30 minutes. If it's a face only, it's 15 minutes. Protective eyewear is provided and recommended to be used when light is concentrated near the facial area. So if the lights are in front of your face for 15 minutes, I recommend you wear the protective eyewear. Before and after your therapy, I just want to say, it's like not like a sunbed where it can damage your eyes. It's not that kind of rays, but it can irritate and make your eyes red. And no light should be stayed into for a long period of time. Okay, before and after your therapy, drink water before and after therapy. Before your treatment, drinking water is to optimize the hydration of the fat cell so the light will target the fat cell. After your treatment, drinking plenty of water will help to flush your lymphatic system and rid your body of the fat and toxins. Shower before your appointment and remove any makeup or moisturizers. For the best results, it's always recommended to use lead products on clean skin with no serums, moisturizers, or body lotions. This allows the light therapy to effectively penetrate the skin without any barrier. Try to avoid foods and drinks such as bananas, pineapple, potatoes, beans, grapes, etc., or alcohol that turns into fat and will work against this treatment and will lessen the result. For best results, refrain from alcohol the day before as well, and caffeine will dehydrate you, which will decrease the results. Exercise. Try to avoid any physical therapy or exercise before your session. Studies have found that applying red light therapy before exercise yields more favourable results. And you could break a 30-minute session down to before and after. So 15 minutes before an exercise workout, 15 minutes after your workout. Every individual may respond differently to specific treatments, and results will also depend on the goal you want to achieve. However, with regular use 2 to 3 times per week, you should see improvements in 4 to 6 weeks. Check with your GP to see if light therapy is right for you, especially if you have medical conditions or are taking medications. I can't stress that enough. Appointments and cancellations. Appointment bookings are all via Fresher, which connects to my Google Calendar. Or to discuss a booking or the appointment processes beforehand, contact me to arrange an informal phone call at healingaccord@gmail.com. Spelling mistake in there. All bookings are followed up with an email to request a pre-assessment phone call, so your contact number is required along with a good time to call. Specify whether you wish to visit me or would like me to visit you in your home, and that's in travel distance within half an hour, 45 minutes of NE1 Newcastle. Specify any particular area you wish to focus on, any health conditions, medications or skin conditions you may have, and if you've checked with your GP before employing the use of red light therapy. Consultation and aftercare. A brief telephone consultation at the time of booking, followed by full consultation applied to treatment on the day, and aftercare. Appointments are usually booked 4+ days in advance, with a 48-hour period before the booking date for cancellation. If your bookings cancel 48 hours before the day, within 48 hours, a full refund is given, or you can reschedule your appointment for another time. Only one reschedule is allowed on a booking. If it's another booking, you can do one schedule on that too, but it's just to stop it from going reschedule. So one reschedule. Last minute cancellations. So less than 48-hour cancellation is 50% refunded. This is because we are unlikely to be able to fill your spot last minute. Other treatments provided are Swedish massage. I qualified in Swedish massage at Newcastle College. Then we have Reiki. I'm a Reiki master. Energy healing, very relaxing, very effective. And sound vibration therapy with the tuning fork. For further information or anything else you need to know, contact me, Chrissy, at healingaccord@gmail.com.